Very good morning, everyone. Thank you so much for taking the time today to come join us at Loop. We at Practo are super excited to having the second edition of Loop, and especially being in your beloved town of New Delhi. The first time we are doing Loop in Delhi. As we start the day off, I want to take a moment to talk about the strategy behind Loop. The thought behind Loop is for us to be able to connect with our partners, who are providers, payers, and others, to have a dialogue on how we think a digital healthcare can be done. At Practo, we've always worked hard to seeing the best way our products can make an impact in the healthcare world. So I want to take a moment today to thank all the providers who have helped us in our journey so far. So thank you, doctors, and thank you all the providers in the room today and across the country for helping us put our platform together. Thank you. It was 8 years back in 2008 when as an individual, I faced a problem. The problem was very simple. As a son, I had my dad's records with me. These records needed to be taken to a doctor in the US. I was given the task of digitalizing them and sending it across. When I came across this problem, it was in a printed format, so I went back to the doctor. And I asked him that, since this is in a printed format, could you just email these records to me? I can, one, keep them with myself, and two, it'll be also easy for me to send it across to whoever I need, and there'll be a history that I can create for myself, especially for my dad, who always had a very chronic knee. When I asked him for this request, he looked at me and told me that he would love to do it, but unfortunately, his software only had a print button and did not have an email button. And this provoked a very important thought in our minds, that why is it that technology can't enable both providers and consumers? And also, as individuals, as human beings, why we cannot have data about our own health with ourselves on the touch of a tip of our fingertips. Each one of us have our own health to manage, and also we have on ourselves the task of managing the health of our parents, of our loved ones, and also of our friends and family. So it was a very important question that why hasn't, not just in India, but around the world, the possibility of having one's records with oneself. Surely, with Facebook, one can do it with all your social information, and with LinkedIn, one can do it about your work. But around your health, as an individual, just as a human being, we don't have an account. We don't have a place. Today, we take all our decisions based on data. Today, we take all our decisions based on information. But about our own health, we have so little. And that's how the journey began. This journey began with our ability to work with partners and with hospitals and clinics and with doctors. We found partners who were as excited to work for the consumers as we were. We put the Practo platform together to make that happen. And every single Praction at Practo is excited and motivated by the opportunity of helping mankind live healthier and longer. And we think we can do this by building technology and enabling the healthcare ecosystem achieving its goals. And over the last 8 years, we have worked tirelessly on this ability of using technology to simplify the ways in which a human being can stay healthier and can live longer. We have been able to impact 40 million appointments annually. So 40 million appointments annually in India happen on our platform. That's roughly about 1 in every 5 appointments in the top 10 cities in India. We facilitate these appointments, and partnering with hospitals and clinics, we are trying to reach more. The remaining appointments are either on pen and paper or are just lost in unconnected platforms. We've also been able to take this technology to other markets. To Southeast Asia, we found markets like Indonesia and Philippines, which are very similar to India. And in Middle East, and not the least, Latin America. So in all these three regions, we found a home for our products. And healthcare hasn't been resolved in these markets either. There are a lot of similarities between the way India works and the way these markets work. And if you notice, around the world, there hasn't been IT systems or health systems that have been able to scale beyond a particular geography. It's because each country has its own uniqueness of health systems, regulations, and prevents seamless expansion of a health system across boundaries. But Practo, with its platform, we have been able to make small inroads in some of these markets. Our main challenge is to penetrate India more. Our penetration in the top 10 cities is still, there's a lot to be aspired for. And there's a huge opportunity that we see in 100+ cities in India that we are yet to encounter. But the impact we have made of managing 1 in every 5 appointments in the top 10 cities hasn't come easy. And today we'll talk to you about our plans on how we see we can impact the rest and how we see the future for digital healthcare. I'm also super excited by the fact that we have some very prominent speakers today who will be talking about the impact technology has had on their businesses. Be it the payer, be it the provider, be it diagnostics. We have an exciting lineup of speakers who are going to talk to us about the role technology plays in their business. Technology has been changing over centuries. In the 18th century, it was the mechanical revolution. In the 20th century, it is the information revolution. No matter how many times I put up this slide, it's just unbelievable that in our lifetime, in our last 10 years, there's been such a dramatic change. India today is the second largest in terms of a population using internet. We have crossed the United States and are getting closer to China. This kind of a massive change in the number of people coming online hasn't happened ever before and will never happen ever again. So this has been a massive change in the way things have functioned before and after internet. The advent of internet will change every single industry. Be it an automobile industry, be it the logistics industry, be it travel, be it anything. There will be change in every single industry. And this change has also come to the shores of healthcare. In India alone, 150 million queries happen on Google each month on healthcare. 150 million queries, and it's growing really, really fast. There are consumers looking for not just information about ailments, but are looking to do transactions online. They're looking to book appointments, they're looking to connect with their provider, all online. Not just information, but they're looking to transact online. 150 million queries on Google each month and increasing very rapidly. On our own platform, we see tens and millions of searches happening, and we are seeing that number grow as well. So internet has changed healthcare forever and will continue to play a dominant role in figuring out how consumers and the whole healthcare industry will work. Some of the important industries today, be it the providers like clinics, hospitals, and diagnostics, the pharma industry, the med devices, or the wellness and fitness industry, all of them will see the changes that internet will have on them. In terms of the opportunities, it's mentioned as challenges, but in my opinion, it's really opportunities that are there in Indian market today. And the first one is the fact that most of us still pay out of pocket. Insurance penetration is nascent, but it's increasing very rapidly. That's a very unique nature about the Indian market. In the US, 40% of spends are insurance. 40% of spends in healthcare are towards insurance companies. In India, that's still below 10%. Even the role of government is very minimal in healthcare in India. In China, almost 80% plus of the spends happen in government institutes. In India, that's less than 20%. So India is very unique with its ability to be largely out of pocket and very private. And the fact that there haven't been legacy IT systems ensures that new systems that we build are already connected, are already on the internet. And this will ensure that as a country, we will leapfrog the way healthcare has usually evolved and move into a model where healthcare is far more connected with internet. And we'll see payers, we'll see insurance companies doing a lot more going forward. Coming back to some of the very interesting trends that we are noticing as Practo, there are 3 of them I'd like to highlight to you today. There are 3 ways in which the internet is going to play a huge role in the way we see things at Practo. The first one is online consultation. This is already here. Already this market is a $20 million market in India and is growing very rapidly. As the country becomes more and more urbanized, people are going to spend more and more time on the road. It's going to be more and more difficult for people to reach places. In China already, there's a company that does almost 100,000 consultations online each day. That's 3 million consultations in a month. And this urbanization of China will happen in India as well. And we'll see the advent of telemedicine or online consultations taking more and more traction as time passes by. More and more people are spending time on the mobile phones, and as internet and mobile phones become more and more prominent, and urbanization leading to a lack of infrastructure and more time being spent in cars and on the road, you'll see telemedicine growing even faster, even faster. The second very interesting thing that's happening, and India is playing a huge role in this, is med devices. As you have seen, the phones are getting smaller and smaller and more powerful. Similarly, medical devices are getting far and more powerful. They're becoming miniaturized and are now can be far more portable than they were not earlier. And being more portable, they are finding their way inside clinics, inside hospitals as point-of-care devices. And more tests can be done at a fraction of the time. At Practo, we're trying to integrate with as many medical devices companies as possible so that data flow can be far more easier. Today, in a single device, which can be kept at the doctor's chamber, with FDA-approved devices, we can do 8 to 10 tests in a single device with very good efficacies on results. And for the more complex ones, we have the diagnostic centers that we can rely on. So these point-of-care devices are getting more and more smaller, and in the next 5 to 10 years, we'll see a lot more of these evolving fast. The third one, where as Practo we are seeing a huge trend, is around digital data. Be it your health data, your records data, or diagnostic data, all of them are coming together. Earlier this year, we allowed the option of providers to sharing their records with their patients on our platform of Practo Ray. We were surprised that with very minimal efforts, in less than 8 months, 50% of all the records generated on Practo Ray were starting to be shared with their patients. So providers are very open to being able to select what data they want to share, and in a very secure and safe and private manner, share it with their patients. So data is moving much more faster. So we have data, teleconsultation, and med devices as 3 areas where Practo is keeping a very close eye on, and we are seeing humongous amount of opportunity in these 3 places. Especially in med devices, India, we believe, is going to be the place of innovation and a place where a lot of exports are going to take place from. So let's look at what are the things that Practo has been involved in. The way we see the world, especially of that of the consumers like ours, is this journey. This journey of a consumer that starts first with finding a provider, moves on to asking a question, then booking an appointment, finally landing up at the hospital or clinics, which then leads to generation of their health data, payment of their service, a prescription which leads to a ordering of medicines or diagnostic tests, feedback that comes back to the provider community, and the health records that are generated. So this is the entire loop that at Practo we are focused on. We believe that each part of this are already being done, so we don't need to replicate anything. We believe that all that we can do as technology providers is seamlessly ensure that there's no friction as a consumer passes through this journey. So each of these experience that the consumer has, we keep a very close eye on, and we build towards that. We partner with pharmacies, distributors to see how medicines the supply chain can be managed faster, information asymmetry can be removed. We work with diagnostic centers to remove information asymmetry and see how transactions can be done on the diagnostic side. And similarly, on each part of this journey, we try to remove the friction, be it information asymmetry or lack of information, be it convenience of transacting, be it payments, be it communication. We try to understand what is the friction in each of these parts and try to iron them out. So for consumers on the platform today, we have probably the most comprehensive data about providers. 100,000 providers on the platform, tens and thousands of hospitals, diagnostic centers on the platform, and very detailed information about them available at the fingertip of a consumer through a search. We allow consumers to ask questions. We get tens and thousands of questions for free posted on our platform that providers then answer, which then leads to appointments being booked on the platform. 500,000+ transactions happen on our platform each month where calls or appointments are placed on our platform. We also provide information in a very personalized manner to the consumer. So if somebody has searched, for example, about, let's say, dengue on the platform, we are able to then provide them with personalized information that can probably help them with the query that they have searched for. So we have articles and content that doctors have written that goes to the patients. We also provide the ability for the prescription that was generated by the doctors and by the pharmacies to be fulfilled. For this, we partner with distributors and we partner with chemists to locally source these drugs and get it to the doorstep of the consumer. Similarly, with diagnostic checkups, we have been running pilots on home pickups as well as working with partners' labs to make sure that there's easy, convenient way of getting diagnostic checkups and tests done. Through all these different providers, we then collate all the neutral feedback that the patients have and pass it back to the providers. As a neutral platform, consumers trust us to being able to communicate their feedback back to all the stakeholders. And finally, all this data accumulates into our health records that is kept very private and specific to each patient on the platform. For the providers, we have products that can help get their awareness levels up, which is when patients are already online, how do we ensure that providers can generate awareness about the services to them? We also have products that can focus on the patient's experience and the ability to manage one's practice. So these are the parts in which we work to be able to serve the needs of the providers. Later today, we will spend some time taking you through these different buckets of products that we have. And also, through the day today, we'll be having very detailed discussions around some of the very interesting conversations and dialogues in healthcare. Starting off, we'll see on how technology is invading the lives of consumers in the diagnostic space, followed by a deep insight on how telemedicine is being seen through the eyes of both the providers and the consumers, followed by technology's role in insurance companies and payers, and also understanding what are the regulatory hurdles or challenges we face to enabling all of this in a country like ours, India. The main innovation that Practo has been able to put together has been this Hyperloop. This was a creation of ours which helped us solve the problems in healthcare and then take it to the other parts of the world. So all that you saw earlier about the products we built for consumers and the products that we built for the providers is based on this Hyperloop. This Hyperloop is our ability of bringing both the best for consumers and the best for enterprises together to build network effects which can help each other out. And this is the innovation that now we are taking to different countries and have seen good success in. As Practo, we see ourselves as a very neutral platform. We believe that as a new stakeholder, we need to facilitate communication, payment, and information asymmetry in this ecosystem. There are already fantastic providers out there, fantastic payers out there, fantastic pharma companies and med devices companies out there. All that we as a platform need to do is stay independent, stay neutral, and facilitate the growth of this entire industry. So we see ourselves as a role of trying to increase the pie and working with all the partners here today and outside to increasing the pie of healthcare. And we believe that the Indian healthcare ecosystem will continue to grow much beyond the $200 billion and become $1 trillion in size in the coming decade. So thank you everyone for making time for us this Sunday, and look forward to meeting you again at the next loop. Till then, do great. Thank you.